Oh, I see. Whatever. The new 20s is the 30s. Oh, 100%. I agree. Yeah. I mean, definitely. As in my 30s, I definitely like mentally, I still feel like I'm in my 20s. 100%. Uh, I definitely my body's definitely getting older, but mentally, I feel like I'm in my 20s. I agree. I agree. Any anxiety meds you've seen good success with? Yeah, I like Trintellix a lot. Trintellix and Vibrate. Those are some of the new ones I've been using. So I like those two. Zoloft and amantadine for autism. Yeah, you can. Amantidine's like off label, so it's not like gonna get you amazing results, but it can be used as an augmentation to whatever else you're doing. You don't need any annual physicals yet, like colonoscopy or prostate check. Yeah. I mean, thankfully I'm not at that age yet, but I do get I do get blood work now to check stuff. And yeah, it's just subtle changes. I noticed that I need more sleep to function well. I can't eat crappy foods anymore. They affect me, my cognition or my skin. Hangovers are brutal now. So I don't even like to go out and drink. Versus like in our early 20s, like we would go out every week or something. Um, I can't even drink milk anymore. It just hurts my stomach too much. Mm, greasy foods like pizza, everyone loves like downs. I used to work out like weightlift like 6 days a week, and now I only do two or three. Plus, I have boxing as well, but just because I find I just get so fatigued between recovery is slower. I work all the time, yet none of the time. So I'm self-employed, so I was dependent. Not everyone responds equally, but it's all always dosage dependent as well. Minecraft, no. I play different. I play Marvel Rivals, but I don't play Minecraft. Yeah, that sleep stuff is going to. I don't really like those kind of sleep meds because patients are very sleep resistant and they have problems, but it's not ideal. Concerta was great for my child the first week. Now it's not really working as well anymore. Yeah, I would look into their diet first. I mean, tolerance can definitely build for Concerta, but also there's like a period where it stabilizes. So like, the first time you try it, it's like, oh yeah, this is great. But then it stabilizes. And so typically what you have to do is that you have to increase the dose a little bit because the first one is just kind of like the newbie. It's almost like beginner gains in the gym. So, you have the newbie gains, but then after that, there's like a stabilization. Typically, you have to increase it. And then when you increase it, you find the nice neutral dose. And that's the dose that people really do well on. Do you have a work crush? Yeah, myself. I look in the mirror and I'm just like, wow, amazing. Let's go. Let's go. Yeah, full on narcissism, right? Is ASPD a true disorder or actually advantageous? It was ASPD antisocial. Not everyone who has, and not everyone has trauma who has antisocial personality. Can energy drinks be more impactful to a person recovered crystal user? No. Imagine crystal boost is going to be like 100 and energy drinks are going to be like a 10 or 15. Energy drinks also have their own problem. Energy drinks have tons of problems with like all the artificial gunk they add in there. If you want caffeine, just drink pure black coffee. Simple. Simple. Under what circumstances would you keep someone on medication for life? If they have problems getting off of it, or they have, if their issue is still persistent despite them coming off, or if they're functioning really well on it, right? Like a lot of people, they just function better on the medication. Like for example, like I take dry eye drops. Like I'm gonna take those for the rest of my life. Simple. But it's very common. Yeah, nice. Also, we're at 18.8K likes, right? 18.8K likes right now. Let's see if we can get to 21K. 21K should be very achievable for us. Yeah, 21K should be very achievable. Can I message you my symptoms? I get so many of those messages. If you really want to work with me, best way to do that is to book a consult in my bio. Have you ever dropped a patient? Yes, I had one patient who was seeking out stimulants, uh, and like doctor shopping around to multiple stimulants, and they got kicked out of the pharmacy for them. The pharmacy called me and told me what was going on. I was like, okay, this is not ideal. Yeah, they literally said that like the patient came in demanding and wanting early refills all the time, and like once or twice it was fine, like he'd done that, but like it just got to the point where the pharmacy banned him, and I was like, okay, like this is too much. If the pharmacy has banned you, then like clearly there's a risk factor here. I love listening to you. Oh, thank you. I appreciate it. I'm just trolling 95% of the time. So take it all with huge salt drains. Salt grains, salt drains. I have DPDR, loss of appetite, feeling easy. Yeah, I would make sure to get an evaluation, right? So hard to say. But honestly, prioritize sleep. Sleep is going to be the number one thing. Focus on getting that checked in, and everything else will get better. Just finished my master's in social work, thinking of med school. I mean, I wouldn't just be. It sounds like you're unsure of what you want, right? So I would clarify that, because then it sounds like you're just kind of hopping from thing to thing. More school is probably not the answer that you seek. What would you have gone into if not psychiatry? Probably radiology, to be honest. Radiology, maybe. Yeah, maybe. No, I wouldn't want to be a family med doctor anymore. Yeah, probably radiology. Well, Costas, how's your hairline doing? Good. How's your coming out of the closet doing? Is that well? Have you done it yet? I know you were hesitant last time we talked, but hopefully you're able to do that. You know, I'm so proud of you for your courage in sharing that, and I really hope that you're able to finally embrace who you are. Why do patients with BPD have trouble with a relationship? Because they have a central fear of abandonment, and so they are always afraid that they're going to get abandoned, so everything gets perceived as a threat, like, you know, raising of voices or any kind of invalidation or slow texts, and then that stacks that feeling of abandonment stacks on with emotional dysregulation, so not being able to control their emotions very strongly, so their emotions kind of go up and down all over the place, and so those two things cause a lot of problems in relationships. How to help if it takes me like 1 to 2 hours to fall asleep every night? I mean, I will stop doom scrolling for one. I guarantee that, like, you know, you're probably laying in bed, like, scrolling on your phone. So that'd be the first thing. Second thing, get rid of caffeine. Just don't have any caffeine. 17-ish, and so she had this persona of like a older Jewish man, and so she would want to wear a yarmulke all the time, and will like have adopted this much deeper voice, and like genuinely like was acting like this character, and it was very like not faked, like it felt very real, right? So and then she sometimes would revert to this other her normal kid self, and then but like a lot of the time was this older Jewish self, and I forget what the family trigger. There's some kind of family stressor that was going on that had triggered that transformation. I can't remember what it was exactly. Why does mirtazapine 15 make me hungry? Yeah, because mirtazapine is it's an appetite stimulant, so very common. Can a crystal-induced schizophrenia person fully recover? Probably not. If the crystal has induced schizophrenia, then it's unlikely. Have you had patients flirt with you? Yeah, sometimes. I remember I had one patient who I had matched with on Tinder, but this was like if they were a patient. I mean, I'd matched with them, and then like this, I was in residency, and we were in a small town in Michigan, and then you know it never went anywhere. It was just a match, and then fast forward like 4 months later, and she's a patient in the clinic, and so I remember going to my supervisor, and I was like, hey, you know, this is the situation. What do I do? And the supervisor was like, well, did you mention it? I was like, no. And they were like, he was like, did they mention it? I was like, no. And I said, well, so he said, okay, well, you know, as long as there's no problem, then, or like, he's like, did it go anywhere? I was like, no. So I was like, okay, well, as long as there's no problem, then, you know, you can continue. And so we continued. And then, yeah, it is what it is. How do I get used to snoring sounds? I'm not sure what that means. Like put on earplugs if snoring bothers you, or fix whatever the snoring is around you. I don't know. Thoughts about PA school? I mean, I went to med school, so I can't really tell you. I want it to be the PA school. You'll get done very quick. You'll get done quick, so that's easy. But you're always going to be working under someone instead of being the boss. So it depends on what you want. I'm gonna fire my psychiatrist. Can I hire you? Yeah, if you want to work with me, best way to do that, you can book a consult in my bio, and we can see if we're a good fit to work together. I could hire you as a collab. No, no, I'm good. I'm not. I get so many collab requests that I'm not. That's not something that I really want to do, just because I won't be able to do it adequately. But that's why I have a whole PMHNP academy. So that's why I can give my expertise to NPs, but not having to give it to more people rather than just like individual one by one. So you can definitely check that out too if you want to learn from me. Do you still see her? No, no. This was in residency. This was in residency. Is it hard treating girls with EDs? Yeah, EDs are one of the hardest things to treat. It takes a village to treat EDs. Like I remember when I did my child fellowship, we had a whole ED unit, and there was a whole ED program where there was family therapists and there was dietitians, and like on the psychiatrist side, we only saw them once a week because the medication stuff was very low. But there's DBT therapy. Family therapy is the biggest part. Um, they're involved with adolescent medicine, who was managing their weight and their electrolytes and all those things. So it's a very hard thing to treat, and I definitely am not an expert at treating it. What dose for magnesium? Yeah, 120, 240, 360. It just depends, especially if you take it for sleep. But magnesium's, you want to do glycinate for sure. Glycinate or threonate, either or. ED is eating disorder. It's one of the words that TikTok bans. So they ban that. They will flag you for saying, like unalive, like what the real world is. They'll flag you for substances, like specific substances. So those kind of things. So yeah, but nice. We are cooking. We got 20K people or 20K likes in here. So let's go. Let's see if we can get to 25. 25K should be our SH2. Yeah. Let's see if we can get to 25. I think we've been working. We've been cooking hard on this chat, man. Like we talked about sleep today. We talked about med stuff in general. Trolling a little bit. So a lot of things that have been going on. Family therapy. Yeah, we talked about EDs. We're talking about vitamin D. Yeah, vitamin D is very hormonal, so it affects our dopamine production. I actually just wrote. I'm filming a video on the supplements that I take, and vitamin D is one of them. So yeah, I mean, it affects dopamine production. It affects melatonin production. Vitamin D is super, super crucial. It's a signaling hormone for neurotransmitters. So very, very crucial. When will the video be ready? Probably in a couple weeks. I've scripted it all today. So I have my script ready. And then I'm going to film it tomorrow. And then probably upload within next couple weeks. So yeah, I take 5,000 IUs of vitamin D. Like you see all those supplements right there. Like I'm making a video on all the supplements that I take. So definitely stay tuned for that. It's gonna be a banger. Basically, all the supplements that I use for cognition, because that's what I'm trying to optimize, is like my brain functioning and my cognition. I'm flying on a plane and I have a benzo script. Will they confiscate? No, I just don't tell them. It's your medication, bro. Like they don't know anything about your medications. Like they're TSA. They're not doctors. Yeah. What are clear symptoms for people with narcissistic personality disorder? I mean, it's basically that they narcissistic behavior ruins their life and they're not able to identify how much their functioning is being affected. That's all. You prefer to date within, without medicine? Oh, out of medicine. I don't think I've ever dated anyone in medicine. Always out of medicine. Just, I'm not a very type A person, as you can tell. Most medicine people are like stuck up and like things got to be perfect and risk averse. Whereas I'm more like loose and free and whatever, like go with the flow, uh, chill, right? So it's just different vibes. Different vibes, bro. I take mirtazapine and alprazolam, but the mirtazapine isn't helping. Should I be able to just have the alprazolam? Yeah, alprazolam's not as good long term. It's good short term, but not as good long term. Man, my PHQ is 22. Life is hard for MDs. Well, you have to curate your life to make it what you want, right? So the freedom, if you're an MD or a doctor, you don't have to be trapped within the system. You have the freedom now to control your life how you want. So if you're working too much, reduce your hours. If you don't like your work, change your job. Like, for me now, like I work all on my own. I work on social media. I have my own private patients. So like, but like all that took work, right? To create, like I had to kind of create, I had to Minecraft my reality. And so similarly for you and for anyone listening to this, if you're not happy with your life, ultimately you're the only one who can change it. Like, no one wakes up saying, "Oh, how can I make his life better?" Nobody wakes up and says, "Who? No one else is trying to make my life better." Similarly, right? No one else is waking up and saying, "How can I make your life better?" No one's doing that. So ultimately, the only one who can do that is you. You have to wake up and you go, "How can I make my life better?" And then, it's a mountain, right? It's a journey. And so you have to take the steps to progress along that journey. I guess it just seems very simple to me. Because the way my whole life philosophy is that life is a video game. And so just like we try to level up in a video game, we can level up in real life. So we can level up our stats, or we can, progress, explore more areas of the map. We can level up our physical skills or our social skills or our cognitive skills, right? We can get new gear, like new whatever supplements, or we can eat things to get our HP up. So eat good foods like that, right? So all you can do is basically just you analyze where you are on the chessboard and you make the moves that you can, or you analyze where you are on the map and you make the best moves that you can. And obviously, sure, some people start off better than others. Like it's 100%, of course, but it's like either you can complain about it or you can do what you can, right? So like it literally is what it is. Why do you, how do you think? Why do you think that one girl fell in love with her psychiatrist? Yeah, I made a whole video on that, so you can definitely check that out. But I think a lot of the video was just clout chasing. A lot of it was just clout chasing. I mean, it's like imagine you post 1 or 2 videos and then it happens. So of course you're gonna just like delve into it further and further. And that's actually another thing that's been popping up recently. It's called AI psychosis. And basically the whole idea is that like let's say you're kind of simmering with psychosis, well then you talk to AI and AI is just trained to reinforce whatever you say. So now if the person's kind of simmering, you're you're like, oh yeah, maybe everyone hates me. Then AI is like, yeah, everyone hates you, of course. Like you saw the way they looked at you, and then the person's psychosis just goes up, up, and up. And there was a point. There was a reason I was going to make that point. Oh, the girl fell in love with a psychiatrist. Yeah. So now imagine like you make a video and it blows up, and then you make another video, and then it blows up. Well, that's going to only incentivize your behavior to keep making more videos about that, and then you start believing your own stuff too, further and further in. Just asking before if you could help. Yeah, just don't take the alprazolam long term. That's the key. My doctor wants me to stay on lithium for bipolar 1, but I'm worried about long-term effects. I mean, it definitely can occur, don't get me wrong, but bipolar 1 untreated is also very bad. As a PMHNP student, I really appreciate your channel. You're really your purpose. Forgive me for answers. What was the motivation behind your channel? Yeah, so basically, I had a lot of NPs reach out to me, and they were like, "Hey, I don't understand this. My job doesn't teach me anything. I don't learn anything in PMHNP school. Can you teach me X? Can you teach me Y?" Like I was doing these lives, and I was like, "Huh? Like I think there's some like what's going on here." And so I just created a program. It was like just like a basic landing page, just a basic website for a program. I was like, hey, if NPs want to learn from me, let me just start this. And then I had 10 people sign up in the first week or so. And so I was like, oh, like I think there's something here. And then just went all in and never looked back. So yeah. What's the max time I should be on alprazolam and clozapam? I mean, some people have to take it longer, but there's just longer risk of dependence and longer cognitive risk long term. Like there's no like people always want like what's the right dose or what's the right time. Like unfortunately with psych that does not exist. With other stuff like okay, if you have an STD, you take azithromycin for X days, X dose, and you'll be fine. Like it doesn't work like that. If you have a cough, right, you take this. Those are very standardized doses. Psych is not standardized at all. Do you open your program up to other mental health professionals? No, then it will lose focus. Like it's only dedicated towards teaching psychiatry. So it's mainly psych NPs who joined because they want to learn from me. But I've had some PAs join as well too. I have some psych residents who have joined as well. Just because like I'm teaching the foundations of psychiatry, everything I've learned in residency and fellowship. Basically, my mission is to teach everything that I've learned in the field of psychiatry to people as a psychiatric clinician who prescribes, right? So I can't open it up to therapists and counselors and psychologists and stuff just because like I'm not an expert in those fields, and it's going to dilute the quality of the program if we just make it open to everybody, right? Like it's got to be specific to people, and I would rather help the one group that I can help them tremendously rather than try to help everyone a little bit. I'm having trouble finding a preceptor. I'm a CRNA transitioning into psych. Yeah, I would honestly just ask in our group, because our group members can help find a preceptor. Like that's a super common thing. My daughter is a nurse and now going to school to be a PA. Nice. Is lamictal and lithium a really common combination for bipolar 1? Yeah, super common. Super, super common. If you were to stack 4 supplements for cognitive function, what could they be? Yeah, check out my videos coming out in a couple weeks for the best supplements for cognitive function. But I'll give you a sneak peek now. So, and this is all stuff that I take. So creatine, omega-3, magnesium glycinate at night to help with sleep, and probably zinc to help with testosterone, at least for a guy. If not zinc, then maybe ashwagandha, because ashwagandha can be really helpful for cortisol. Oh, no, I take it back. Vitamin D. Vitamin D. Vitamin D, yeah. Thoughts on taking massive dose of lithium orotate, so elemental lithium? I've never heard that before in my life, but if you want to take as much lithium orotate, you'd have to take like, I don't know, 20 pills of lithium orotate to reach lithium carbonate. And by that point, like, what are you even doing? Like, I have no idea how that's going to be, but I doubt it's going to be very effective. I wish this doctor could be my psychiatrist. Yeah, you can book a consult with me if you want to. Most of my patients find me on social media anyway. So yeah, that's literally the way that I do it. And I honestly like that because then, right, like you get to see this is the raw interaction. Like this is real life right now. And so, if you vibe with me, if you're like, okay, like this guy can help me, then boom, like, we could work together. But if you're like, okay, F this guy or is full of himself or, I don't agree with him, then you just scroll up and you move on with your life, right? Like that's perfect. Rather than what happens is that you go to see some doc or some provider and then maybe you like them and maybe you don't, but you have no idea till you've already stepped in the door. Now you've already wasted your time. So it's better for me that way, it's better for patients that way. So it's literally win, 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 win. Where do you work? I work all telepsych, so I do all remotely by myself. What state are you in? So I'm in Michigan currently, but I have a bunch of state licenses across the country. So you can just check it on my website, see if I'm licensed in them or not. Are you licensed in Connecticut? I'm not, unfortunately. I used to live in New York, So I got New York, New Jersey, Pennsylvania, but not Connecticut, unfortunately. Is it safe to ashwagandha long term? Yeah, I think it's pretty safe. Ashwagandha's been around for a long time. But why don't we call it there? We've been vibing for a while. Oh, you left New York City. Yeah, I left NYC. It was honestly getting so distracting for me. Like I wanted to spend some time working on my business, working on my patient care, just doing some more self-improvement stuff. Like I've been getting into boxing recently. Just living a much more cleaner lifestyle, which was more hard, and as you can imagine, it was hard in New York City. So, yeah, and so that's really helped me. But I'm probably gonna be my goal is to move to Miami within like 6 months. So that's my vision right now. Obviously, things can change, but that's my vision so far. Is right now my focus is developing our Psych and P program. So I'm just making that even better and better. Like it's already done, and like the vast majority of it's done, but I'm just making it better and better and better. All right, just I want it to be perfect. I want it to be like the best thing on the internet for the people I'm trying to help. Like it's got to be the best. It's got to be the best. It can't be just average like all the other programs and stuff. Like they're so average, or they're so like only covering a small aspect of psychiatry, like maybe the history or maybe some medications. Like I'm covering fucking everything: psychiatric diagnosis and treatment, child and adolescent psychiatry. I just added a module on substance use, integrative, all the supplements and integrative psychiatry, all the gut health testing stuff. I'm going to be adding a module on geriatric psych, on yeah, geriatrics is gonna be the next thing. I'm adding a neuroscience module, career coaching, basically like everything, every effing thing that I've learned in psychiatry. Like that's what I'm putting into this program here. So it takes time though. So I'm trying to make that perfect. Yeah, just doing more of these live streams, doing more of the YouTube. So I've been getting better and better as a YouTuber. So I've been really focusing on getting good as a YouTuber. So that's been a goal of mine. Um, yeah, just leading a nice, clean lifestyle. That's been huge for me. Just staying nice and clean. So that's been very helpful, right? Sleeping well, eating clean, you know, not not like staying up late and partying and things like I was in New York for a little bit. So not doing that for the last 4 or 5 months now. 3 months, 3 months, 3 months. Yeah, getting into boxing. I've been wanting to do it for ages, and now I finally said, you know what, I'm gonna do it. So I've been doing that for 3 months. Uh, yeah, those have been the main things, really. Yeah, yeah, yeah. So yeah, I think now is a good time to end it. But yeah, I'm glad that we've been vibing. I think it's been like at least an hour and a half, to be honest. So uh, yeah, if not longer. But yeah, yeah. I hope this was helpful. I think we'll do that tomorrow. I think we'll go live tomorrow now. So right now, what I have coming up is we have a coaching call. So in our academy, so every Monday, we'll do a coaching call at 8:30 where pretty much our students will come and they'll ask me questions. They'll bring up their cases that they're dealing with in clinics and their work, and so I'll give my input on it. Uh, and so we do that every week. So you literally get to ask me your clinical questions live. Um, so we're gonna do that at 8:30. And yeah, that's the main thing I've planned. But otherwise, yeah, I think I'll be live tomorrow, probably in the afternoon ish, maybe around the same time. Because tomorrow morning I'm gonna go to the gym. It's actually funny. I was thinking of live streaming at the gym. Just kind of like, having my phone out and then like, live streaming and talking between sets and like working out. I don't know. I'm debating it. So if it's like, I don't, if it's super empty, then I might do it. It may not be. I don't think it's gonna be empty though. There's always people when I go around like 10 a.m. ish. And right now, because I'm in more Michigan area, like this kind of stuff is weird here. Social media is weird. Back when I was in New York, like no one gave a crap, right? Like no one gave a crap about social media. It's like it's a very normal thing. But here here it's weird. Like it's not like a normal thing to get into. So I'll see. I'll see. I'll see. I'll see. Plus, I'm also debating like because if I'm live streaming, I'm not listening to music. So it's different when you're listening to music versus not. But I don't know. We'll test it out. Yeah. But yeah, that's the main thing I have tomorrow. And then I'm actually, you know what I'll do is when I film YouTube videos, I'll go live. So you can actually see me go live on YouTube videos. Like you can actually see like the recording of it. And then yeah, I might do that actually. That's a good idea. But yeah, other than that, yeah, I think we're gonna call it here. So hope today was fun and I will see you soon.